reintroduce Dr. Whitney Gray, who actually works for Delos. And Delos and the mother, or I should say their sister company, International Well-Building Institute, realized that these problems that Ola has mentioned were stemming mostly from the workplace. And to that, they came out with the Well-Building Standard, which is based on medical, scientific, and architectural research. So it was the first time ever that architects and doctors got together. So without me going any further, I'm going to let Whitney get into a little bit more detail on how IWBI and the Well Standard are tackling and conquering the problems that Ola has mentioned.
Well, thank you so much, James, for having us here, and we could not be more excited about our HOK partners around the world because we need architects dearly. In fact, architects, planners, some of those real estate agents out there, and developers, sustainability experts may have a greater impact on the future of the public's health than physicians. And no physician has ever fought this for me, and that's because we know the stats. We know that 70% of your health is determined by behavior and the environments that you spend time in. And who is experts at those? The people I'm looking at. And I've never met anyone, and we were doing the math the other day, and it's a little over 10,000 people around the world, a two dozen countries that I've had a chance to speak to. And I oftentimes ask architects and planners and designers, have you had a chance to go through your formal training, and did anyone pull you aside and say, this health thing, do you want some education on that too? And there's no formal system that currently exists for those fields that requires you to have health education. And we are changing that, I'm glad to say. And a lot of the experts and leaders that I'm looking at in this room that I've known for many years that have been doing this way before anyone else, you self-taught, you self-trained, and it's really hard. As a person in public health, if you asked me to build a building, I'd be like, oh my God, like where do I even start with this? And yet I'm coming to you and being like, you're the future of public health, and yet there hasn't been any formal training in it. And by the way, when that project needs to be on budget and on time, like yesterday delivered, can you please spend like a month hanging out with my public health colleagues up at like Mayo and Hopkins, and we can just like hang out and talk about health, and then you can put in your project design? No, it's just not the reality of it. And I've never had an architect say to me, like, Whitney, I'm just dying to design an unhealthy building. That's what I've been dying to do my entire life. Rather, they come to me and they're like, make it work for me, make it accessible. I get that health's important, believe me, I'm a human trying to do this every single day. And so our job at Well International Well-Building Institute and through Delos is to give you the power through the Well-Building Standard, is to give you the path.
Our goal at the bank has always been to be an environmental leader, and I think some of the conversation around environment and wellness is starting to bleed together. So this was a natural next step for us, and I had mentioned kind of the low-hanging fruit of the things that we could do to improve environment and improve quality are gone. So now we're looking at more deeper investments, and what the Well tool gave is a great way to codify what to do, because it is sticky, it is messy, and I don't know what to do. And the great thing about a third-party certification system is it lays out a path for you. And when it's designed for the real estate market in mind, it's going to tell you, design this, operate that, build this way. So it gives a path to try. And move some of these conversations along. So for us, it was a natural next step where we are in our evolution. We feel like we've got, lead pretty well down pat. We know the benefits of it. We know where to apply it, where to take some of the quick wins from it. And so diving into wellness and looking at that pairing was a natural next step for us.
So it's interesting because, as Whitney had mentioned, there is sort of like it's a complex issue. There is no really one silver bullet or one solution. So similarly with measurement. So if you're going to have a complex solution to a complex issue, then your measurement would be actually multi-pronged and multi-level as well. When you ask about whether productivity, certainly productivity, I think, is one of the typical measures that people would normally in the business world go to. And frankly, actually, even in public health, I know when we initially sort of started looking, like, how do we go and talk to human resources professionals? Like, how do we actually go and talk to employers? Like, what's really important, right? So, you start with the research and you see, okay, like, what's there? So, productivity. Okay, well, let's get our data, on productivity. But when I talked about the impact of chronic diseases, we actually see the impact multi-level. We see the impact on society at large. This is where the 4 billion, so 4 billion in both direct and indirect, as well, and this is just for the GTA. Then we look at the impact on our healthcare system, and this is where the investments that are going to the healthcare system, where typically the investment could be diverted to building schools, building offices, building infrastructure, doing other things. So that's sort of another level. Certainly the productivity costs, I think, this is something. And then cannot discount the measure and the importance of the personal well-being.
Do you want me to answer that?
I think you should start, yeah.
So yes, there is actually tons of data out there that contribute positively towards that. We've actually gone as far as to take all of the critical features of well and put them into what we call a deck of cards, so that clients like you during a vision session can pick those ideas from the well rating system that you want to implement on your project. So it's kind of like give the choice to you on what you want to see within the building, but still adhering to the preconditions of well, because with well, you're still required to meet the 25 preconditions, and then it's up to the owner to decide how much further they would like to take that. And one of the preconditions is actually the staircase. So exposing the stair and making sure it's the first thing you see in a building. Even there's some graphics that are out there that are really cool, where you put signage on your elevated door and it just says, there's a free staircase, 2 steps away, to discourage people from taking an elevator for 2 floors. So yeah, the framework is definitely there, and we as an organization have been developing a library of those best practices that we can implement in the building. But it really does come down to, is the air okay? Is the water okay? How is the lighting, right? And that's one of the biggest ones, is people don't realize your circadian rhythm is always running, and it's very impacted by a dark office environment. So that's a big part of that we focus on here internally, but is also a huge focus of the well rating system.
And so this is a partnership for us, is that we're going to give you the best research that we know, and we're going to give you constraints on human health, but you're going to tell us how you design to meet those constraints.